In the heart of Geneva, where the World Health Organization coordinates global health efforts, a significant announcement was made on September 5, 2025. The global fight against Mpox, once a rapidly spreading concern, has taken a hopeful turn. After months of tireless efforts and collaboration, the WHO has officially lifted the international public health emergency status for Mpox. More than a year ago, the WHO declared Mpox a public health emergency of international concern, a designation reserved for the gravest health threats. This declaration followed alarming spikes in infections across Africa, especially in the Democratic Republic of Congo, Sierra Leone, Uganda, and Burundi. Back then, the virus was spreading steadily, and the world braced for a prolonged battle. Yesterday, however, an expert emergency committee convened once again, reviewing the latest data. They advised that the situation no longer meets the criteria of an international emergency. The WHO's Director General, Tedros Adhanom Ghebreyesus, accepted this advice, citing sustained declines in both cases and deaths in the most affected countries. While this marks a significant milestone, it is crucial to understand that the threat is far from over. Our understanding of Mpox has deepened considerably. Scientists and healthcare workers have unraveled the virus's transmission pathways and identified risk factors that increase the severity of the disease. Importantly, countries with the highest burden have strengthened their response capacities, improving surveillance, diagnostics, and treatment availability. Yet lifting the emergency declaration should not lull us into complacency. Flare-ups and new outbreaks can still occur. This virus, like many others, thrives on vulnerability and gaps in healthcare systems. Vulnerable populations remain at heightened risk, particularly young children and individuals living with HIV. These groups require ongoing protection through vigilant surveillance and targeted interventions. It is a reminder that the fight against Mpox is not simply about counting cases, but about safeguarding the health and dignity of the most vulnerable among us. But what exactly is Mpox, and why did it prompt such global concern? Mpox, caused by the monkeypox virus, belongs to the same family as smallpox, but is generally less severe. The disease is zoonotic, meaning it spreads from animals to humans and transmits primarily through close contact. Symptoms can range from fever, headache, and muscle aches to a distinctive rash and lesions. While the fatality rate is lower compared to some viruses, complications can be severe, especially in resource-limited settings. The timeline of the Mpox outbreak is a lesson in global health response. From its emergence in mid-2022, cases spread rapidly, reaching over 80 countries within months. Many high-income countries managed to contain outbreaks quickly, but African nations endured prolonged struggles, often with limited resources. This disparity highlighted the need for global solidarity, investment, and support to contain infectious diseases wherever they arise. The World Health Organization's emergency declaration triggered a coordinated response that brought resources, expertise, and attention to the crisis. Emergency committees, experts, and frontline workers mobilized quickly to halt transmission and protect communities. This level of coordinated effort is crucial in preventing local outbreaks from escalating into global catastrophes. Across Africa, countries took ownership of the response. Health workers went door to door, educating communities and conducting contact tracing. Mobile clinics reached remote areas, providing diagnostics and vaccinations. These efforts, alongside international aid, built resilience and saved lives. Scientific breakthroughs complemented these efforts. Researchers gained critical insights into how the virus spreads, including the role of close physical contact and the impact of co-infections like HIV. This knowledge allowed health authorities to tailor public health messaging and vaccination campaigns, reducing stigma and improving outreach. With steady declines in case numbers and enhanced preparedness, the Emergency Committee recommended lifting the public health emergency. This decision recognises the progress made, but also underscores the necessity of continued vigilance. Surveillance systems must remain strong, particularly as international travel and urban density create ongoing risks. Preparedness is a continuous process, not a one-time achievement. Challenges remain, especially in ensuring equitable access to vaccines and treatments. Many rural and underserved communities still face barriers to healthcare. Strengthening health infrastructure and integrating Mpox response into routine health services will be key to preventing future outbreaks. In closing, While the World Health Organization's decision to lift the Mpox emergency is a hopeful step forward, the global community must maintain commitment and collaboration. Vigilance, compassion and resilience are our greatest tools in safeguarding health and preventing future crises.
More than a year ago, I declared a public health emergency of international concern over the spread of Mpox in Africa on the advice of an emergency committee convened under the international health regulations. Yesterday, they met again and advised me that, in its view, the situation no longer represents an international health emergency. I have accepted that advice. This decision is based on sustained declines in cases and deaths in the Democratic Republic of the Congo and in other affected countries, including Burundi, Sierra Leone, and Uganda. We also have a better understanding of the drivers of transmission, the risk factors for severity, and the most affected countries have developed a sustained response capacity. Of course, lifting the emergency declaration does not mean the threat is over, nor that our response will stop. The possibility of continued flare-ups and new outbreaks remains, requiring adequate surveillance and response capacity. Ongoing efforts are needed to protect the most vulnerable groups, particularly young children and people living with HIV.